Good morning. My name is Jean-Bernard Poulard. I'm the Patient Safety Officer at Queen's Hospital Center. I'd like to welcome to our celebration of Patient Safety Week in 2021. Patient Safety Week is 1 week in March that is set aside for us to celebrate the achievement over the past year, to pause and reflect on the journey of patient safety in the hospital, as well as recognizing the teams and individuals who work very hard to keep us on track in our journey to patient safety, to establish a patient safety culture at Queen's Hospital. It's also a time for us to renew our commitment to the process of keeping our patients safe. First, I'd like to share my mental model of what patient safety is with all of you. First, it means that patients should not suffer undue harm during our processes of care. As we know, it is a high-risk environment that we work in. Our hospitals are a high-risk environment. We have the potential to make errors and to cause harm are legend. We have errors of commission, errors of commissions, medication errors, procedures that do not go as planned. We have involvement of human factors that may decrease our performance. We have own biases, and we have other human factors that can interfere with the way we care for our patient that can put us at risk of causing harm. However, the expectation in our field of work is that we should be a high reliable organization. High reliability organization really are organizations that are engaged in work that where errors can cause significant harm. And there is a component of high quality in high reliability organization because they have to deliver a high quality product, but they also have to do it in an environment that is fraught with danger, but they have to maintain safety as they do it. The Institute of Medicine describes safety as one of the pillars of high quality care, the other being patient-centeredness, timeliness, efficiency, and equity are all the other pillars of high quality care. But safety has been at the forefront of what we see every day in the literature, as we see every day in the practice of medicine. And achieving a culture of safety is the holy grail. That is when safety processes and a way to look at safety is embedded in what we do, so we don't have to think about it anymore. If we look at high reliability organization and compare to how they achieve this culture of safety and how we can adapt and be like a high reliability organization, they pay attention to certain things. One of them is attention and sensitivity to operation. They are always aware of the operation. They design the operation so that they are the safest that they can be, and they don't leave it there. They continue to monitor the performance of those operations. They are preoccupied with failure. They're always asking what can go wrong, and there's always continuous learning. And we do in healthcare also. That's why we do FMEAs, the failure mode analysis, where we look at the process and see what the weak points are and we mitigate against those. They've also practiced deference to expertise, which means that we call it in our language situational leadership. Anybody can be a leader depending on the situation. The person with the most knowledge, the most skills, and the most experience occasionally has to take over and be a leader in a situation. And we have to accept that. And we cannot have hierarchy that are so hard that we cannot break that when the time comes and patients are at risk. We have to also practice the reference, the reluctance to accept simple explanation for complex things that happen. Healthcare is a complex process involving a multitude of discipline, a multitude of processes, and also materials and drugs. So the interaction of the human with those multiple processes is always complex. So we cannot rely on simple explanation when something happens. We have to dig deeper. That's why we do root cause analysis, so that we can determine what in the system needs to be looked at, to be repaired if needed. We also have to practice resiliency, which means in the middle of difficulty, we have to be able to continue operating. We have to be able to maintain our processes going. We have to mitigate against further harm. We also, at the same time, we have to repair. No, repair not only the processes, but the individuals involved in those adverse outcome or unfortunate event. We have to be able to restart the engine better. We have to recover and be a better organization after things happen. We also have to establish accountability, and accountability cannot exist outside of a just culture. We have to have a just culture. People have to feel that they are safe psychologically, physically, and they're able to express themselves, to express their views, and to explain and to learn without undue fear. And the last one is the partnership with our patients. We have to partner with our patients and family because we cannot do it all alone. Patient safety culture is difficult to achieve. Why is it so hard? Because around us, we see example of industries that are not just. When something happens, we see heads roll. And this is all around us, and even in our organization sometimes. And people question that. And we have to make sure that it is psychologically safe. We have to make sure that we deal with systems, not individuals, because the majority of people do not come to work to cause harm. They come to work with good intention. The system sometimes fails them. The bad apples that we look for are rare and far to find. Occasionally we have to deal with it, but the just culture teaches us how to do that. We have certain principles, certain accord that we agree to, so that the institutional responsibilities are reflected as well as the individual responsibility. So that's why it takes courage. It takes consistency to apply, to live by those rules that are just and fair, and then we can continue to have progress toward a just culture. Patient Safety Week also emphasizes the fact that we're not alone in our interest to having a just culture and a culture of accountability and a culture of safety. We have our regulators. The Center for Medicaid and Medicare is also interested in patient safety. The regulators include the New York State Department of Health, who monitor what we do, and we have to report adverse events to them. We also have the payers that are telling us that they will not pay for undue harm, unnecessary harm. So we all have to be cognizant that we're constantly being observed. In addition to the payers, I say we don't really need them because we have our own consciences to deal with. None of us come to work to cause harm. We come to work, we have taken the Hippocratic oath, first to no harm. We also have our own conscience, even if we're not in healthcare. We want to do unto others as we would like to do unto us. So those principles should guide us so that we think about the human aspect of patient safety and treat others as we treat ourselves as safely as we can. So how are we doing at Queens? We always say it takes a village. And in healthcare and in patient safety, it really takes all of us. We all patient safety officers, we all patient safety champion, because we want to do our work, the work that we are facing with the patient, as safe as it is. Throughout the week, you will hear from other members of the patient safety team. We'll hear from our colleagues in the medical field, in the nursing department, in the clinical side, in behavioral health. We'll hear from pharmacists, from respiratory therapists. They're all involved in this difficult job of providing care safely. And there are all hosts of others who are at the leadership level in our medical staff office, making sure that the people that we bring on board are qualified and trained and safe. All of us are involved in this work. So I wish for all of you to spend this week talking to your colleagues, listening to them, and sharing with them your experiences along the journey of patient safety. Have a great patient safety week at Queen's Hospital.